yields back, and now I recognize the gentlewoman from Texas, Representative Fletcher.
Thank you so much, Madam Chairwoman, and thank you to Ranking Member DeGette. Thank you to all the witnesses for your testimony today. It's been very helpful, and I appreciate that all of you are public servants who care about the health and well-being of people across this country and have dedicated your careers to doing that, and we're here to talk about those things and your recommendations today. So I really want to thank you not only for your testimony, but for your work. At the same time, I have real concerns that once again, even if we reauthorize these programs, we won't have the funding or the staff to carry out these important recommendations and implement the information that we're hearing. I brought up this concern in April when we first were at our hearing on the over-the-counter monograph user fees reauthorization, and I just don't understand why we are having another hearing on this, on reauthorizing a program that supports FDA's work while simultaneously allowing the Trump administration to gut the FDA's workforce. This applies to the program reauthorizations under consideration today in these bills that fall under HRSA as well. And, if everyone doesn't know, HRSA is slated to be eliminated completely as an agency under HHS, under Secretary Kennedy. We had him here a couple of weeks ago. We need to have him back here because these are hugely important questions. This is going to be eliminated as a sub-agency, and it's all part of the administration's effort to shrink government, and many of the critical workforce programs that we're talking about that HRSA oversees were slashed in President Trump's budget that this Congress is considering and seeming to move through without opposition, without objection to cutting the federal workforce, to cutting these agencies, to cutting the work that's being done to help people in our communities and to keep them safe and to help them be healthy and healthier. And it's not included in the authorizations that we're talking about today. But one example of a workforce program that was eliminated in the president's budget that we talked about a little bit earlier is the Children's Hospital's Graduate Medical Education Program, the residents in children's hospitals. This has traditionally been a bipartisan program with a ton of support, and it is the only federal program dedicated to training pediatricians. And our resident pediatrician already asked her questions, but we know from people across our districts that this program helps train the doctors who take care of our children. And it is eliminated in the president's budget. It is completely eliminated. The president has decided this is no longer worthy of support. So, I have questions that I'm going to ask the witnesses, but my real question is for the Republicans on this committee. If we reauthorize these programs, and in the next budget, the president eliminates them, are you going to vote against them? Are you going to do anything to object and to fight for the programs that everyone here is saying they wanted? We're introducing bipartisan bill and bills about reauthorizing programs that we are letting the Trump administration, and when I say we, I mean half of this body, the majority in this body, over the strong objections of the people on my side of the aisle, are letting the administration run roughshod, are doing whatever the president wants without question in cutting agencies, in cutting funding, in cutting staff, in saying they want to get rid of all these things. Will you vote against that? Will you object? Will you stand up for the things that we are talking about today? If we pass the over-the-counter reauthorization and there are no staff to review over-the-counter drugs, are you going to care about firing all of them then? We can put a stop to this here in Congress. We can do that. We can say no. We can vote no. And I would like to see that happening in this committee and in this Congress. So, Dr. Chen, I took longer than I thought to ask my questions of my colleagues on the other side of the aisle. So I have a question for you that I'm going to submit for the record. You talked a little bit earlier about your experience and talked about, in your testimony, obviously, you talked about the various programs. And I would like for you to speak about how the Children's Hospital's graduate medical education program helps address the pediatric workforce shortages as well. I'm out of time, so I'll look forward to your answer in writing in the record, and I will yield back. Thank you so much.